And action. Okay, Donald had a great question. It was, why are his morning erections not there anymore? And this happens to be a topic that a lot of my guys ask, or at least I have to pry it out of them. I'll break it down into 4 different reasons. And truthfully, whether it's a morning erection or nocturnal erection, also known as nocturnal penile tumescence, or just an erection anytime you want to perform, it can be from all 4 reasons, no matter what age. But I think if you remember these limits with the age groups, elderly, middle age, and youth, you'll kind of remember why. So we'll start with the elderly. The typical reason is going to be decreased testosterone. So as you age, the testicles will usually decrease on their testosterone or androgen hormone secretion. Just like women go through menopause, men go through menopause. And theirs isn't as sudden as a woman's. A woman's hit into menopause and suddenly cutting off the hormones that they're relying on can be surgically induced, like with hysterectomy, or can be rapid with other diseases that might pop up in your 50s or 60s. Men come and go into it gracefully, and you don't really notice the hot flashes, although I noticed the hot flash the other night. But when testosterone is decreased, you'll notice decreased muscle mass or muscle responsiveness, decreased bone thickness, an increase in cholesterol, but also decreased sexual desire and then erectile dysfunction. So when I have somebody complains about that, I'll always first have the testosterone drawn. But you have to be careful, because ultimately if we know what caused it in the age group and I get the blood test, and nowadays insurance doesn't really cover testosterone. It used to. It used to cover shots, sometimes the pellets that you can get put underneath the skin every few months or weeks, but now it doesn't, which is really terrible, but that's just the way the insurance goes. I like using bioidentical or sending off to my compounding pharmacists. I think it's cleaner and cheaper, but I've heard some of my guys going abroad or going outside the country to get testosterone, kind of like anabolic steroids are used or mailed away for. You can probably get them anywhere. I'd be very cautious about what you're getting and the quality and what else is in it. So one way to check and see about the next reason, and the next reason will be blood vessels. So as you get older, blood vessels narrow. When the blood vessel narrows, not as much blood flow comes from the blood vessel, and the way the penis works is when the right amount of testosterone and parasympathetic response is initiated, blood leaks out of the blood vessel into the corpus cavernosum to fill up that spongy tissue, and that's where the erection comes from. So if the blood vessels are narrowed, even if the tissue is ready to get an erection, there's just a little bit of the blood coming from the blood vessel because it's narrowed. It's kind of like taking a fire hose and trying to put out a fire, but now using a garden hose to put out the same fire. And that happens with blood vessel narrowing. Blood vessel narrowing happens from cholesterol, diabetes, high blood pressure, irritation and inflammation to the lining of the blood vessel, and this is usually an age group related disease. Sometimes I've seen my 30 and 40-year-old patients come in with it too, because they've developed their diseases faster. But usually I see it at 50. When that happens, certainly you want to try to take blood vessel medicine to relax or open up the blood vessels. But more importantly, if those blood vessels down in the penis are being narrowed, you got to worry about what's going on with these blood vessels up here. So if there is truly a blood vessel disease issue, I would always seek out what's going on up here. I wouldn't just give the Viagra. So that's one of the ways you kind of check it out, is if the blood vessels aren't working properly, giving Viagra increases nitrous oxide or NO, and NO makes the blood vessels just open up and perfuse or fill the fields, increase that corpus cavernosum size and fill up the spongy tissue. But the inherent side effects of opening up the blood vessels in the penis are you also open up the blood vessels in the head. and or the heart. So you can have problems with blood vessels of the heart, especially if you're on nitrates. Blood pressure drops fast, or headaches because the blood vessels start to almost do the same thing as a migraine headache. So side effect is common, but if Viagra and or Cialis or Levitra, all those medicines don't work, I'd be very careful about, first, number one, concerning the testosterone problem, but number two, looking for a really stenosed blood vessel disease. So that's about 50 years of age or so. And then comes the middle-aged diseases that also come before the narrowing of the blood vessels. That would be like diabetes and or high blood pressure. Diabetes tends to be when you're overweight, have a body mass index that's into the 30s, anything greater than 25, then you will have a tendency to have excessive sugar. Sugar in the system, in the blood vessels of the bloodstream, usually irritate anything, any kind of tissue, so the tissue, when it becomes irritated, defends itself against the high sugar and it stops listening. So one of the important components of diabetes is that because the nerves are very delicate, they don't want to be showered by too much sugar, so they shield themselves up, and the nerves don't listen and don't work anymore. They don't fire anymore. So it's almost like an electric cord not taking electricity through and being frayed. It won't get electricity through, so your light bulb won't work, your radio won't work. Same thing with anything that's dependent on me asking, say, the brain tells the finger to move. If I can send an impulse, it tells the muscles in the finger to move. But if I send the impulse and all the nerves are irritated and or defensive because of sugar, it won't move, it won't fix itself, it won't heal up wounds. You'll have numbness and tingling. You'll have breakdown of skin. So all those things can happen in the penis. If the penis is supposed to have an erection, well, the stimulation from either auto-stimulation or sexual arousal, foreplay, when the nerves are being choked off, you won't get any stimulation, you won't have any feeling at all. So that's more of a middle-aged disease. And with middle-aged disease comes the medicines. Medicines have heavy side effects. One of the side effects would be erectile dysfunction. Another side effect is depression, especially with high blood pressure medicines. So with multiple medical problems comes multiple medical medicines and prescriptions, and those come with side effects. So that just screws everything up. Not only do you have low testosterone, narrowed blood vessels, but you have all the side effects from the diseases that we should be conquering or controlling. So that's why I always say, if you can control your disease naturally with healthy lifestyle, good sleep, eating properly, exercise, get off the medicines, and maybe those things, the narrowed blood vessels and the testosterone will come back again. I mean, I do that regardless, just because I want to get you off medicines. So finally is probably the most common in early age group, 20s to 30s to middle age, maybe even into elderly age, if you are totally stressed out and or there's performance anxiety and or you didn't sleep at night properly and or you've had too much caffeine or you're taking too many sleeping pills, alcohol, cocaine, then you'll have the messages from the brain to stimulate arousal and erection will get choked off. When you have erections, it's supposed to be because of the parasympathetic system. And when the fight or flight is turned on, and that doesn't mean you have to be in a fight or you have to be running away from danger. It could be small fight or flight things. That's why I always talk about mindful practice to shut off the fight or flight response or neutralize your little stressors during the day. It's important, and this is one of the most important things, is you need to have a stress neutralizing activity. You don't, all my patients don't have to meditate. That's what I do, but that's what I found helps me with calming down, lowering blood pressure. So whether it's meditation or some form of nature walking or some form of mindful practice or some form of cognitive behavioral therapy or just a short time of the day when you're relaxing or praying, whatever you choose, there should be this practice to turn on the parasympathetic response, to turn on the relaxation practice, to turn on mindful practice, and turn off the adrenaline, norepinephrine response. So remember, in my previous videos, I told you it's either the body is in fight or flight or it's in parasympathetic love. When it's in fight or flight, penis doesn't want to work. I mean, it's not supposed to. If you're in fight or flight, you want, as a species, you want all the blood and the energy and the ATP to go to muscle, to brain, to heart, to get ready to fight. When you're in love, you don't care about sending everything to muscle, so you want the penis to message. You want clitoris to be working. You want the mood to be attractive. You want to be in love, producing serotonin, oxytocin, happy, and you cannot be in both at the same time. So my guys who think that they can tolerate stress because they're tough, usually they might not show it, but they're in persistent fight or flight. Low grade perhaps, but persistent. Remember, if that's persistent, this thing doesn't turn on. Parasympathetic, if the parasympathetic system is not turned on, there's no way you get an erection. So it takes a lot to turn this on. Sometimes people will have alcohol and they'll turn off the fight or flight and they'll turn on alcohol, but that's not really a great response. It takes practice. Being in love, having a high testosterone like my elderly guys, that'll help obviously, but even if you have a high testosterone level, no matter what your age, 70, 50, 40, or 20, if you have a high testosterone, but the sympathetic system is really on fire, it'll shut down the testosterone. So the sympathetic system is always the trump card, and it'll always outmaneuver any parasympathetic or testosterone levels. It'll even outmaneuver, even if there is if there's high testosterone, wide open blood vessels, no medical problems. If it's stress, it's going to trump everything. So it is important to practice a relaxation practice. It is important to keep a good body weight. And by the way, getting a good night's sleep is much desired activity. The morning, which is what Donald had asked me, the morning erections, or sometimes a nocturnal penile tumescence episodes, you can have them with REM sleep. It's suggested it happens during REM sleep. And if you watch my video, DrRic tutorial, Reset Your Clock, you'll see how REM, if it's significant, you'll have 6 REM cycles per night. And technically that makes 6 erections per night and then 1 in the morning. So those of you who don't get a good night's sleep because you have too much caffeine or you're taking sleeping pills, remember, sleeping pills get you to sleep and shut your eyes, but they don't give you dream states, so you don't get the REM, especially if it's Xanax and some of the hypnotics. So be careful if you're taking those medicines and you're thinking you're getting some sleep. It always takes a good circadian rhythm resetting. So better REM, better sleep, deeper sleep, more testosterone effect. Better sex, better erection. More disease, more weight, worse as far as penile tumescence and erection. Narrowed blood vessels, there's no way the penis is going to work. And then low testosterone. Again, you're not going to have the penis working. So those are the 4 reasons that I usually look for when somebody says that they don't have erections anymore or they don't notice them anymore. It's just up to your doctor to kind of figure out where you are with regards to age, your priorities, and how it's affecting the rest of your lifestyle. Hopefully this helps. Good question, Donald. Tune in or subscribe to me for more of my questions answered on Dr. Ric's Minute Clinic.